Hi, I'm Dr. Kelly Wallace, and this is Catawba Heights Animal Hospital. Come on inside, let's take a look at what we have to offer. Let's go inside and see what we have. Here we go, we're going inside. We have our hours of operation and who to reach in case of an emergency. We have our lobby here. You can provide prescription foods, meet our wonderful receptionists. Hi, Martha. And we have our flea, tick, and heartworm prevention. When you come to visit us, you'll be put into one of our 3 exam rooms. Let's take a look. So we can go in here. This is exam room 3. We try and use this for cats or small dogs, but any dog can use it. It's set up at lunch right now, but we have information on our signage board, pets, pictures of all kinds of pets around, and other information for all of our clients so they can read and educate themselves while they're waiting to see the veterinarian. This is our pharmacy. We have the ability to fill most medications in-house so you can go home with them right away, same day, and start the medications. We carry a variety of medications from antibiotics to medications for their heart, insulin for diabetics, including flea, tick, and heartworm prevention for your pets. This is our in-house laboratory. We're able to perform your pet's blood work in-house when we need it right away, usually within 20 minutes. We have the ability to check your pet's organ function like liver and kidneys. We have the ability to check your pet's red cell, white cell, and platelet counts. We also can check a urine with our machine and the microscope. We have the ability to send off aspirates right away to a pathologist and get a review within 24 hours so we know what that mass is on your pet so we might need to address it. We also have a microscope to look at any cytologies, ears, skin, bacteria, cultures, all kinds of things under the microscope to see what we're working with. This is our treatment room. This is where the magic happens. This table here is one that we routinely use for your pets if we need to draw blood, maybe do anal glands, nail trims, perform small procedures like maybe a biopsy. We have all of our equipment here that we need at arm's length reach for your pets. This is one of our 2 ultrasounds that we have. We routinely ultrasound bladders to get urine. We also perform full abdominal ultrasound. If your pet needs more of a diagnostic approach, we have a different ultrasound for that. This is our wet table. We perform all of our dentals here. It goes up and down. It's comfortable for your pets. We have full anesthesia monitoring for the dentals. Every pet gets fluids as well, and the fluids are warm so your pet doesn't get cold under anesthesia. So when your pet's having surgery here, there are certain things that we have to do to make sure they're safe and things go well. This is our anesthesia or surgery prep room. Here is where we clean all of our instruments in a sink. They're ultrasonically cleaned here using various different cleaning materials. And then we autoclave them here. We also distill our own water for our dental cleaning. So we use distilled water in your pet's mouth. And then we store a lot of our equipment for surgery up here. So this is where all the cleaning takes place so your pet's procedures are done correctly and with sterile instruments. Ever wonder where your pet goes when they have surgery here? It's in this room. This is the surgical suite. Here we have a heated table for your pets so they stay warm under anesthesia. We have our nice big surgery table, so Dr. Wallace has all the room that I need to be able to perform procedures. We have our storage. We have 2 amazing lights to help light up the area so Dr. Wallace can work best. We have the ability to give heated fluids during anesthesia or use them, maybe we have to flush out an abdomen or something after the surgery. Then we have our anesthesia monitoring over here. Every pet gets fully monitored for anesthesia. Their oxygen levels monitored, their end-tidal CO2, blood pressure, temperature, heart rate, respiration, and an ECG, which is the electrical conductivity of their heart. And then we have our backup oxygen. We have an oxygen generator that we use right over there. And then we have a portable oxygen anesthesia machine for our dental cleanings, but also if any pets need anesthesia while we're doing something like x-rays. This is our kennel area back in the back where your pet comes during the day if they're staying with us or if they're having a procedure done. Here we have several kennels. We have Winnie here today. She had a dental cleaning, got her teeth all cleaned up. We have our nice new ultrasound that's very good at doing diagnostic abdominal and thoracic ultrasounds. Kayla, my RBT, performs those. We have our dental digital x-ray here. We can take x-rays. Well, we take x-rays of every pet when they're having a dental to make sure all their teeth are healthy under the gum line. And then we have our x-ray machine to take any x-rays of the body part other than the mouth. In case your pet has a broken leg, we're looking for fluid in the belly or the chest. That's our x-ray machine. Last but not least, our cat room. We have a room separate for cats. We try and keep our cats in during the day when they're staying here for procedure or if they're being hospitalized. We do have 3 cats that live here full time. We have Dorothy, Jamie, and Bo. You may not see them very much. They like to stay in the back. They don't like to be around the dogs, but they have their own separate kennels. They have their own fluid system in here. The cats that live here have their own food area. They have a bed. It's Bo's favorite place to lay. But this is an area dedicated solely to cats. So they don't have to mingle with the dogs. We can cut the lights off and we can shut the door even, so they're nice and comfy and quiet and not stressed.